also creates a shrinkage of the muscle or the muscle around the joints. If you're muscle in your quadricep, in your muscle of your thigh, then what can happen is that muscle doesn't just go weaker, it doesn't just lose mass, it shrinks, it's smaller, so it puts more pressure on the joint. When it crosses that knee joint, it compresses the knee joint. So now, you're taking the steroid, one of the other problems aside from muscle loss, bone loss, is weight gain. So now here, you've created a muscle loss that slows down your metabolism, that also contributes to a weight gain, but you've also created a new pain problem because where you've compressed that joint, you get more friction. So when you're up and walking, normally that muscle shrinking leads to compression of the joint. As the joints compress and you're gaining weight, now there's more pressure on the joint from gravity and from weight, but there's also more pressure on the joint because that muscle is tighter and atrophied. So it's a vicious cycle. It doesn't go away unless you stop the cycle from happening. The only way that you can stop it is to figure out, again, this really is the question of the day, where is the pain coming from? What is creating the inflammation in the first place? So again, corticosteroids can cause muscle loss, bone loss, weight gain, water retention. The other nutritional side effects of corticosteroid use, vitamin C deficiency. So here we're seeing vitamin C again. Corticosteroids can cause vitamin C deficiency. They can cause vitamin D deficiency. They can cause calcium deficiency and magnesium deficiency. So vitamin C, D, calcium, and magnesium deficit, all as a result of chronic steroid use. Remember, we talked about C a little bit already, but vitamin D deficiency is linked directly to being one of the triggers for autoimmune pain. So rheumatoid arthritis, for example, and lupus, people with vitamin D deficiency, their pain levels are much, much higher because vitamin D is a regulator of the immune system. But vitamin D deficiency also causes muscle loss, and that's one of the reasons why we see corticosteroid use cause that muscle loss. But again, remember, corticosteroids are a catabolic hormone, so they cause muscle loss through catabolic action, but they also cause muscle loss through vitamin D deficiency. So again, it's a double hit when we're talking about this class of medication. Calcium and magnesium deficiency are very, very critical for regulating the electrical properties of your muscle. Remember that your muscles are controlled by nerves. They contract and they extend. They go in and they go out, just like so. And so with a calcium and magnesium deficiency, what happens to the fibers of the muscles is they'll spasm or they'll get tighter. So your muscles will be tighter. It's almost like what we hear from people in the clinic is that no matter how much I stretch, my muscles stay tight. No matter how much I get a massage, my muscles stay tight. No matter how much I get a chiropractic adjustment, my muscles go right back and they're tight. This is very, very common for somebody who's got calcium and magnesium deficiency because these electrolytes serve to help the muscles stay fluidic and to help the muscles stay limber and loose. And so with those deficits, the muscles tighten. So again, now we get shorter muscles because of muscle loss. We get tighter muscles because of electrolyte disturbance. And so again, the muscles are getting tighter, they're getting shorter, they're atrophying, they're compressing the joint even more. That's creating a state of exercise avoidance and exercise intolerance, which leads to additional, degradation, because lack of motion, lack of movement causes muscle atrophy. So it's a very, very vicious cycle. And if you're using these, thinking that these are going to solve this problem of pain, you've been very, very misled indeed. Now, if we look at the opiate class of medications, this is an important one. Aside from the fact that opiates, I think if I quoted the ex-director, Dr. Friesen, Thomas Friesen, I'm going to read a quote from him because this is coming directly from the CDC. We know of no other medication routinely used for non-fatal condition that kills patients so frequently. We hope to see fewer deaths from opiates. That's the bottom line. These are really dangerous medications that carry the risk of addiction and death. Now, that's because they can kill. And at last check, I think it was 20-something thousand people per year, per annum, were dying of opiate use. Very, very dangerous medications. Aside from the addiction, aside from what it can create for many people, which is that addiction problem, opiates, one of their other effects, side effects, if you will, is they slow down motility. So they slow down GI motility, your GI tract. And so what happens to a lot of people is they're not just on an opiate, but they're usually, oftentimes, they're mixing
You know, they're using opiate, but they're using in between the times where they can take their opiate medications, they're either taking some other type of non-steroidal anti-inflammatory, right? And so you're mixing it. So it slows down GI motility. So now you put this drug in to a slower pumping gut. And so it stays in there longer. It stays in the gut longer because motility slows down. So now it has the ability to create its damage longer, those bleeding and that GI erosions. It can stay there longer. That medicine has more direct contact with the GI tract when you slow the GI tract down. But aside from that, it slows down GI motility and it leads to constipation issues. Now, constipation can be a major problem because what is in your bowels, right? What are we trying to expel from our bowels? Waste, dangerous bugs, bacteria, viruses, all kinds of things in the food that we eat that can be dangerous. We don't want them hanging out in our GI tracts longer than what is necessary. Normal bowel movement, you should have at least one bowel movement a day. And if you're backed up and you're not having bowel movements for several days at a time, what you're basically doing is you're holding on to all those things that your body perceives to be poisons inside the GI tract. And again, if you're commingling these medications, creating these erosions in this leaky gut, well, if we got constipation and all those toxins are just hanging out in our GI tract, and that GI tract has microscopic pores in it, now what happens is all that garbage just has the ability to leak into our bloodstream. Well, what happens when toxins leach into our bloodstream and our body has to cope and deal with them more aggressively is we feel bad. Why? We hurt. It's a well source of inflammation and chronic pain. So you want to be aware of that correlation, of that connection, because again, this drug, one of its main problems is severe constipation. A lot of times, you know, I see this happen a lot in the hospital environments where doctors will just put people on Miralax or other stool softening agents to overcome this. But again, still doesn't negate the dangerous impact and effect that these medications can have. Then we have the class of immune suppressing medications, and these drugs definitely are linked to cancer, lymphoma. But what do? They suppress the immune system. What they're doing, remember that inflammation is created by the immune system to try to protect you. And if you suppress your body's capacity to protect you, what are you really doing? You're not just opening yourself up to lymphoma, but you're opening yourself up to chronic infection. And of course, chronic infection is a well source of inflammation. And so we don't want to trade one for the other. This isn't the trading business. We're not in this whole conundrum to try to trade one symptom for another, try to trade one problem for 5 more problems. And many of those problems can lead to very dangerous problems like a lymphoma. We're trying to figure out where this is coming from, where that pain and that inflammation are coming from, so that we can get a natural resolution without having to inject all these different toxic compounds that have known side effects. And if you've ever been to a doctor's office and they said, yeah, we're going to go ahead and put you on this because we need to treat the inflammation. Inflammation is what causes the disease. You need to ask the next question, which is, well, what causes the inflammation? And if they can't give you an answer, it may be time to look at asking another doctor who maybe will have that conversation with you. My advice is go find a good functional medicine doctor to have that conversation, because if you don't know where your inflammation is coming from, all you're really doing is suppressing your body's natural ability to protect itself by warning you that you have a problem and that you need to make some type of change. We don't want to suppress symptoms artificially, chemically, without knowing why they're there, because that's not going to lead to anything positive at the end of the day. We may improve our quality of life in the short term, but when you improve your quality of life in the short term by creating something that has the potential to kill you, creating an environment that has the potential of death, or creating an environment that has the potential for severe nutritional deficit and for severe body morphology changes that can lead to more problems that are associated with more pain and associated with more inflammation, that doesn't really get you to a winning position. You're doomed if that's the only route that you're entertaining. Now, what happens to some people is the pain is so great. Now, let me just say this. I'm not talking about a person who's in severe acute pain, who needs the pain relief in an acute environment. Okay, I'm not talking about severe acute pain. I'm talking about chronic pain, chronic degenerative arthritic conditions, chronic autoimmune disease. I'm also not talking about people who have massive tumors and they're in severe pain and they need the easement of that pain because they have an inoperable tumor, something that's so space occupying that they are going to have a problem. So I'm not talking about those two scenarios. There are times where pain medication can be helpful, can be beneficial, and is the right call. It's just generally not the right call when somebody's struggling with a chronic inflammatory disorder of unknown origin, not because the origin is unknown, but because the doctor didn't take time to investigate what the origin actually was. So, again, I wanted to preface that because I don't want people to think that there's never a time for pain medication. Certainly that there is. A broken bone for a week or so after a broken bone, a pain medication can really help a person get through, but that's an acute pain and it's not a chronic use. SSRIs are another one. These are drugs like Paxil and Prozac. They're used to manipulate serotonin or to preserve serotonin in the synaptic cleft. But the problem with these medications, there's an old saying, a lot of times these drugs are used to treat depressive disorders. So by preserving serotonin, serotonin is a feel-good hormone, it's a happy hormone, but it also plays a role in the way we perceive pain. The problem with these medications, there's an old saying, what goes up must come down. Meaning that when you artificially hold on to serotonin, the body's going to find a way to work around that. And when that happens, we're going to get the opposite effect. We're going to get a massive shift, rebounding effect in the other way. And that can lead to major depressive problems, and it can lead to major pain flares in people. So these medicines are not the answer either. Now, these medicines also can interfere with folate, and they can interfere with vitamin B12, and they can cause the same thing. They can cause GI motility issues as well. So again, they don't come without risk. They don't come without a potential problem either. So again, it doesn't matter which one of these classes of meds that you're using. They all pose a particular threat. They all pose a particular problem that you want to take deadly seriously, because again, if we combine the deaths just from non-steroidals and opiates, we're talking about 36,000 deaths a year. Again, that's not a small number, and if we tally up the quantity of side effects and problems associated with using these drugs long term, for example, steroid-induced lupus, and then lupus leads to immune suppression, then immune suppression can lead to lymphoma, chronic infections, and other problems. If we tally up all the reasons that people might die as a result of using these drugs, we could say the number is probably much, much higher than just 30,000 deaths a year. So again, if you're on any kind of pain medication, you want to take this seriously, take this information, go have a conversation with your prescribing doctor. And I'm going to open it up now for some questions. Hopefully everybody's hearing me pretty well. Okay, let's see here. Like we're having just a ton of sound problems on the comments here.
Yeah, it's working now.
Okay. Okay, let's see here. I'm trying to get to the questions. Yeah, so somebody's chiming in. Nurses have to keep track of the patients on narcotics, again, the opiate class of medications, because if they don't have a bowel movement by the second day, they force them laxatives and suppositories. If you're a double organ transplant recipient, look, that's a category all in and of itself. I would not suggest that you get off your immune suppressing medications because you're trying to prevent a organ rejection scenario, and that's a scenario, or that's a case where what I'm saying here is worth the risk. So stay on your medication as prescribed if you're an organ transplant and you're trying to prevent host versus graft or the organ problems associated when you have an organ transplant. Anti-seizure medications for occipital neuralgia, what about those? Nancy's asking. Anti-seizure medications for neuralgia, The problem with those medications long term is they're actually linked to tremor and other types of neurological problems, particularly because they can influence your B vitamins. So like vitamin B1 deficiency, vitamin B12 deficiency are very, very common in people who have long-term use of anti-seizure medication. So if you're on one for that type of problem, again, go back to why are you having the occipital neuralgia? There's either a physical or a physiochemical problem that's contributing to that inflammation. Kimberly's asking about Tylenol. Yeah, I can address Tylenol. Tylenol's processed through, or acetaminophen. Tylenol's processed through the liver. That's one of the problems with it. Is so, whereas NSAIDs will potentially damage the kidney, Tylenol will potentially damage the liver if used chronically in too high doses. But one of the effects that it has is it actually can deplete glutathione, which is what your liver uses as a detoxifying agent. So chronic use of Tylenol can be just as dangerous, especially if you drink alcohol or you have other types of things that you're being exposed to that can impact or affect the liver. Some people with gluten sensitivity, for example, develop a form of autoimmune hepatitis or liver disease. And so you understand that liver disease all by itself, hepatitis, tends to lead to chronic aches and pains, because when the liver can't take out the garbage and detoxify the bloodstream, then it builds up internally, and that can create a scenario of internal inflammation that leads to chronic pain. So Tylenol, you have to be very, very careful, especially if your liver enzymes are elevated or your liver function is not ideal. You have to think about glutathione with Tylenol. Next question from Cindy. I have SLE and RA and take steroids and methotrexate for years. Doctors want to try one more biological drug. Have had 2 infusions in the past that have not worked. Look, I'm not a big fan of trying one more different type of the same thing. That being said, I can't give you direct medical advice in this scenario, but I can say this with great degree of certainty. A deficit of biologics, which is a class of medications used to treat rheumatological disease, a deficit of biologic is not the cause for the inflammation in rheumatological disease. You have to figure out what the cause is. If you don't have no grain, no pain, if you haven't read chapter 7 and 8 and applied the diet principle in that book for at least 30 days, then that's the next step I highly would recommend anybody who is struggling with an autoimmune arthritis, is to get on no grain, no pain for 30 days, really see how diet can impact the level of inflammation in the body and lead to dramatic improvements in pain. We've seen it in thousands and thousands of people be an effective way to overcome chronic pain. Top suggestions for reducing inflammation, question coming in from Cindy. There are a lot of different things that you can do to reduce inflammation, but here's the thing. What I don't want to do is give you a bunch of supplements to take to reduce inflammation if you haven't addressed some of the core fundamentals. What are the core fundamentals that we need to know about, that we need to do to address inflammation? Number one, if we want to regulate our own cortisol, again, not have an artificial cortisol come in, but regulate our own, then one of the things that absolutely need to make sure that you're doing is sleeping, going to bed at night. In essence, sleeping, especially between the hours of 10 p.m. to 2 a.m. That's a fundamental thing. You can't heal, you can't reduce inflammation effectively if you're not sleeping. Now, some people would say, well, what if I can't go to sleep because I hurt so bad? I need something for the inflammation so that I can sleep better. And yes, we can talk a little bit about that, but I want you to understand fundamentals first. Quality sleep, quality diet, quality motion and movement, quality sunshine, and stress control, stress management, the right support in your household, the right family support, the right loved ones around you. Those are all critical. Those are all essential to the healing process. So if those aren't in place first, it doesn't matter whether you take a pharmaceutical that has the potential to kill you or whether you take something natural that may not kill you, but it isn't going to resolve your problem. Now, there are certain scenarios where I have seen resolution of pain as a result of taking a pill or a supplement, and that's when the nutrient that you're deficient in is actually the reason for the chronic inflammation. For example, vitamin C deficiency can cause chronic inflammation. Vitamin D deficiency can cause chronic inflammation. Magnesium deficiency can cause chronic inflammation. So if you have those deficiencies and you don't get enough of those nutrients in your body, then that is going to lead or can lead to a state of perpetual inflammation and thereby taking supplementals in those situations, in those scenarios, can lead to a resolution or to an improvement of your inflammatory outcome. And so those are things, and just again as examples, what I really highly recommend that you do if you struggle with chronic inflammation is get your doctor to test your nutritional status. Don't just stop shy of vitamin C, magnesium, and vitamin D. You want to test all of the B vitamins. You want to test selenium and chromium and copper and vitamin A and D and E and K. You want to test the essential nutrients to make sure that you're getting what you need, that your body has what it needs to properly control and manage the inflammatory response. Another one that I commonly see that absolutely affects pain. Some people say it affects pain so wonderfully, it's like taking a drug, but it's not really. It's omega-3 fatty acids. Omega-3s regulate the inflammatory pathway. One of the main inflammatory pathways in your body are regulated by omega-3 fatty acids. And if you don't have enough omega-3 fats, these are found predominantly in cold water fish. You can get some from grass-fed beef. There's some precursors to the EPA and DHA and things like chia and flax. But these fats are critical to maintain a healthy inflammatory response. And if you're low in them, you can actually have an increased heightened sensitivity to inflammation and pain. So definitely, so basically, to answer your question, what are some things you can take? Vitamin C, 5 grams a day is a really good place to start. It's very, very safe to do. There aren't really any side effects. Ask your doctor to check your vitamin D. If you're vitamin D deficient, their dose can range, the quantity of vitamin D can range anywhere from 2,000 units a day all the way up to 10,000 units a day, depending on how deficit you are or what kind of health history you have. If you've got chronic kidney disease, I don't recommend taking high doses of vitamin D because it can create problems. But testing so that you can get clarity. The danger of nasal decongestants such as Allegra D, Claritin D, the nasal decongestants suppress the immune system too. They just suppress a different aspect of your immune system. So long-term use will lead to basically a reduction or an increase in your risk for developing infections like viral infections and bacterial infections. But these drugs also don't come without cost, because when you're blocking histamine, which is what some of those classes of medications do, is they're antihistamines, is you're also interfering with the body's ability to produce stomach acid. So now you're starting to affect digestion and absorption of proteins and absorption of things like calcium and magnesium and vitamin B12. And so now long-term use of those can start to affect and impact those nutrients, and then you can start to develop the side effects of nutritional deficiencies as related to those different nutrients. Okay, safe way to wean off of SSRIs. You got to get with your doctor on that one. I mean, that's the safest way is to wean very slowly. Sometimes I've seen people who've come to see me and they've had other doctors in the past try to wean them, and what they did is they tried to wean them too fast. They cut the dose in half on day one, and that's too quick, at least in the experience that I've seen. Most people do much better with a very, very slow taper on the SSRIs if you've been on them for any length of time. So have that conversation with your doctor. Just don't taper too quickly would be the best thought process behind it. Somebody's asking about GlutenMU oil. Marsha's asking about GlutenMU oil. I'm gonna assume you mean the application is topical, so on the skin itself. It's a little bit safer than oral aspirin. You're not going to create a gastric erosion with topical MU oil, so I would worry less about something like that. But again, going back to why do we have the need to rub a cream all over our body? Where's the inflammation coming from, and what is creating that? So even putting an oil, an anti-inflammatory oil, it's not to say that it can't be a better option than some of these other things, but ultimately I highly encourage all of you to go find the source of the inflammation. Janice says, have RA, severe migratory pain after going gluten-free 2 months, but still have moderate RA pain. So it sounds like your pain reduced going gluten-free. Janice, the question I have for you is, are you gluten-free, or are you warrior gluten-free? Like, are you true gluten-free? Are you no grain, no pain gluten-free? And that's what I would suggest that you do, is you get no grain, no pain, and you apply that style or methodology of going gluten-free, because the gluten-free diet, frankly, is a disease-promoting diet if you follow it the way the rest of the world would have you believe it needs to be followed, which is go to the grocery store and buy your gluten-free pastas and your gluten-free cookies and your gluten-free crackers and all that other junk food that's full of processing and frankly isn't even actually gluten-free. So I would ask you the deeper question, which is, are you truly gluten-free or are you traditional gluten-free? Jennifer's asking, about blood thinning medication. Jennifer, I mean, that question, I can't answer that. I mean, the best answer for that is it possible? Yes, it is possible. But you need to have that conversation with your prescribing doctor. Yeah, Plaquenil. Somebody's asking about Plaquenil. Plaquenil, yeah, for the same thing. Plaquenil can also cause the same problems in the GI tract that non-steroidal anti-inflammatories can cause. So the same things apply for Plaquenil as do for the non-steroidals. Yeah, so some of you have had major trauma, and so again, this conversation is less about somebody who went through a major trauma where they fractured a back or they fractured a bone and they have an acute pain, or they have metal implants inserted into the body because the damage was so extensive and there's scar tissue, and even though they went through proper rehab and proper manipulative therapies and things of that nature, they still struggle with chronic pain because the damage was so severe. In those cases, if we're trying to really kind of mitigate pain or be successful at helping kind of ease pain, and those are noble reasons to why you would want to do that, I would highly suggest looking into higher doses of fish oil, omega-3 fatty acids, anywhere between 4 and 8 grams a day of highly concentrated EPA and DHA can be very, very effective. As a matter of fact, there have been some trials that have been published comparing fish oil to non-steroidal anti-inflammatories, and they're equally as effective at pain management and pain mitigation. So you might look into high doses of fish oil as something that can definitely be of help. There are also essential oils, a number of different, and again, these are just topical application because the pain and the trauma was so severe. So there are a number of different essential oils that can be helpful for pain. Lemon balm is one of them. You might also try things like capsaicin gel. Some people are using CBD oils because of their effect on the endocannabinoid system and inflammation. And so there are a number of different options that can be used if your pain is beyond kind of the chronic degenerative disease, but it's more kind of severity, post-traumatic, post-surgical type of issue. Let's see here. So many of you are saying, I've been gluten-free for years and my pain is still here, my pain is there. Again, I would challenge to ask you what kind of gluten-free that you've been. Because if you are not true gluten-free, if you are not, if you're following that traditional, you're eating the rice cakes, you're eating the rice bread, you're eating the cornflakes, you're eating the oatmeal, those types of things, it doesn't surprise me that you're still in chronic pain because technically those grains are actually not gluten-free, even though the label by law can be labeled as gluten-free. So it can be very misleading and you can be very misconstrued as far as what you're doing and what you think you're doing. So again, if you haven't read No Grain, No Pain, I highly encourage you to do that. Also go over to our YouTube channel, make sure you're subscribing, and watch all the past episodes of Pick Dr. Osborne's Brain, because there's a lot of wisdom and there's a lot of information in there that you might find an answer to as well. Margie wants to know how to get EFA, essential fatty acids, if she's allergic to fish, beef, and can't tolerate flax. I would ask, are you allergic to all fish? Because I've never seen a person who's allergic to every species of fish. I've seen people being allergic to different or select species of fish. So I would say first and foremost, clarify for me on what you're actually allergic to, because there could be possible other options. Yeah, turmeric is another one. Somebody's chiming in on turmeric. High doses of turmeric, 2 to 3 grams a day, can be very, very effective. And that's concentrated turmeric to contain 90 to 95% curcuminoid, which is one of the active ingredients in turmeric. Now, some people will just grate turmeric in a lot of their food, put turmeric in hot beverages and have it as as a morning drink, and that's okay too. You can use turmeric as a food medicinal equally as well. Another really effective thing to add with vitamin C, we actually have a supplemental called InflammaShield, and what it is it's a mixture of bioflavonoids and quercetin in very, very high doses. And when you mix that with vitamin C, it can be a very, very effective combination for helping your body regulate the inflammatory response. Okay. I like this. Mary says, Warrior, I love it. She's got the little muscly arm there. Feeling so much better. Only recently ate some potatoes and got terrible joint pain. Yeah, some people react to the Nightshade family, potatoes or Nightshade, and that's part of where their pain can come from as well. Let's see here. So, several people asking about Lyme. I would just simply say this about Lyme. If you've been diagnosed with a Lyme problem and you're on a course of long-term, more than a year, longer than a year antibiotics, I would start challenging or questioning whether or not that's an accurate assessment. And go have a conversation with the prescribing doctor or with the diagnostic doctor. Because this is my experience. I'm not saying that those of you with Lyme don't have Lyme. I'm just saying that if 1 to 2 plus years of antibiotics isn't enough, then it's probably something else that's being missed, and it might be good to just have a deeper conversation with that clinician to have a deeper level of investigation. Okay, let's see here. Let's see. Omega-3 for vegetarians. There aren't a lot of great sources of vegetarian omega-3 in high doses for chronic pain. I mean, you can use, there are some supplementals over the counter that are algae-based or that are flax or chia-based, but it's very, very hard to get the level of EPA and DHA from a vegetarian-based omega-3. And there are certain situations where even if somebody, is a vegetarian, where getting that level corrected, getting that level improved is more important than vegetarianism sometimes. And it doesn't necessarily have to be that way forever, but sometimes you got to get your levels up high enough so that your body can start responding properly. Love it. Allie says, been on a true gluten-free diet for a year now, have healed my joint pain and migraines. Thank you for all you do to spread the message. You're welcome, Allie. I'm so glad you shared your story here in the feed. Let's see here. Answered that question already. Answered that one. A lot of the same questions. Love it. Daniel says, hardcore warrior. Love the warrior mentality. Look, the reality is you've got to have a warrior mentality, because everybody around you, including a lot of the doctors, who are going to look at you when you try to change your diet to the no grain, no pain type of lifestyle. They're going to call you crazy. They're going to look at you like you're crazy. They're going to try to disvalidate everything that you're doing because they don't want to look at themselves and admit that what they may be doing is actually wrong. So that, that's just human nature. They try to pull you in their direction. Smokers, they hang out with other smokers, and if you quit smoking, they don't like you anymore, or they try to pull you back in, right? And it's no different when you decide to get healthy. When you decide, and you're hanging out with a bunch of sick people, you've made the decision to get healthy, you have to have a warrior mentality, because without that warrior mentality, you're going to let those people drag you right back in. So you've got to be the warrior for yourself. Linda says, please say again, vitamin C and what helps inflammation? Quercetin. So again, we have a supplemental called InflammaShield, which is high-dose quercetin that works really, really well in tandem with vitamin C. Do I know much about trigeminal neuralgia? Yes, I do. And I've seen a number of people with severe trigeminal neuralgia do very, very well with diet change. Very, very well with diet change indeed. I've seen cases that people struggled with trigeminal neuralgia for years, and it's a very excruciating situation. I mean, some people, with the pain is so great, they're teetering on suicide. Like, that's how bad trigeminal neuralgia pain can be. So the best thing that you can do, just generically speaking, is dial the diet in. Find a good functional medicine practitioner, get allergy tested, get nutritionally tested, rule those two things out, get the diet dialed in, get nutrition supported, and go see a good either chiropractor or somebody who's well versed in the physical structure of the skull, of the body, of the skull, particularly where the trigeminal neuralgia or the trigeminal nerve exits, because sometimes there's subluxation or kind of a dislodged soft tissue or even dislodged hard tissue that can lead to some of these problems. I've also seen problems in the jaw, root canal issues that have led to people's trigeminal neuralgia. So seeing a good environmental dentist might also be helpful, a helpful step for your husband as well. Okay, let's see here. Let's see, internet's running a little slow. Okay, we've got a few more questions coming in here. Kirk, I like it. Kirk says, get rid of dairy and sugar. Absolutely, dairy and sugar, getting rid of them can make a huge impact for a lot of people. Let's see here. Can I comment on dairy? I mean, I did a whole show, Kirk, on dairy a while back. If you type into my YouTube search engine, dairy versus gluten, and I did a whole hour on that a few months ago, and that'll help you out quite a bit in understanding the science behind why that dairy can be a very bad idea for those of you who are trying to be gluten-free. Okay, let's see here. Roger says, my daughter keeps having a low ferritin level. Last test was 12. Is that a deficiency of a mineral or a gut problem? It's a good question. It could be either one. Low ferritin. So ferritin is iron storage. And low ferritin doesn't necessarily indicate just all by itself an iron deficiency. There are other things that can influence ferritin being low. So ideally, if a woman is menstruating, and I don't know how old your daughter is, but a menstruating female should have a ferritin somewhere ideally above 50 and preferably around 70, 75. And any lower than that could mean that there are some iron metabolism problems. Now, it could also mean a gut problem where the person's not absorbing iron as well. And so, for example, gluten sensitivity can damage areas of the stomach that help us absorb iron. It can damage areas of the small intestine where iron is absorbed. So sometimes malabsorption syndromes can develop when people are gluten sensitive. Now, there's a third caveat in this case. If she's a menstruating female and she has very, very heavy cycles or hormonal disruption or hormonal abnormalities, she could be losing a lot more blood than what is typical for a woman, and that blood loss could actually lead to a slow loss of iron over time. So it really could be any of those three things, and that's where I would have I would recommend that you go back to your doctor and have them do a full iron panel workup where they're checking for iron and they're checking for a complete blood count with what's called a differential. So they're looking at things like MCV, MCH, MCHC. These are the color, the size, and the shape of the red blood cells. Sometimes those are indicative of anemias as well. But also have them measure for copper, and because sometimes copper dysregulation can interfere with iron. So measuring that as well can sometimes be very, very helpful in regards to getting a complete picture of what needs to be done. Okay, let's see here. Yeah, so Jennifer says, 9-year-old son with piriformis muscle pain and leg pain that moves around. Gluten and dairy free for about a year. Pain comes and goes. I mean, there's a lot of next steps. If you, again, going, well, number one, is he gluten free or is he gluten free, right? Is he true gluten free or is he traditional gluten free? You've got to, you've got to go the way of the warrior when it comes to gluten free. You can't beat around the bush. So that would be the first differentiating question or next step that I would definitely solidify. The other is that if this is piriformis pain, there could be a sitting issue or postural issue. There could be if the piriformis muscle is going into spasm and compressing the sciatic nerve and creating kind of a radicular type of pain pattern. It could be a muscle balance issue. It could be a posture issue. It could be a chronic sitting issue. So have them evaluated physically as well, because that may be something that is not been done yet properly. Yeah, if you've had, Dawn says she's been after the surgery. It's been 3 months since the surgery from her knee. If it's been 3 months and you're in that much pain, then probably you've got deeper nutritional issues that are going on, because generally recovery from a knee replacement with today's techniques and today's orthopedics, these guys are doing a lot of these surgeries very, very well. And if a person's in relatively good shape and relatively well nourished, they should recover and not be in chronic pain 3 months post. Like, it shouldn't be so severe. So you might, again, go back to your doc and ask your doc to run and check you for nutritional deficiency, because a lot of times post-surgically, people don't heal because they went into the surgery malnourished. They went into the surgery vitamin C deficient or copper deficient or calcium deficient. And so, surgery is scheduled trauma. You're doing purposeful damage in hopes to repair something so that you can get a better life or a better quality of life post, right? And if you go into it malnourished, remember, your body uses vitamins and minerals to heal from a surgery. So if you go into it malnourished, you may not recover very effectively. So people that tend to have what we call failed surgery syndromes or post-surgery pain syndromes, those people are the ones that really need to have their nutrition levels looked at and dialed in. And also make sure that you get your food, check for food reactions and food reactivity, because part of your pain may not even be that you needed a knee replacement. I mean, it's hard for me to sit here on a video and say that. I've never seen you or looked at you, but might just get a second opinion. Go to another doctor and get a second opinion. Let's see, Cynthia. If a person has been dealing with gluten and leaky gut for several years, is it possible that the intestines are more prone to tearing or ruptures? Yeah, I mean, it's very possible. If you're gluten sensitive and gluten has been creating an inflammatory damage to your intestine, is it possible that you could have a rupture? Yeah, I've seen that a number of times. People have come to me after years and years of being misdiagnosed. They were actually gluten sensitive. And the reason they're in my office is because they just got out of the hospital because they had an intestinal rupture. So it's very possible that could be the case. Okay. Robin says, replacement for steroids, asthma, and RA. The replacement, in my experience, helping people nutritionally is diet change. That is the replacement. As you change your diet and the inflammation subsides, the medicines no longer are strongly necessary, and you work with your doctor to wean off of them. Can glyphosate cause inflammation? If so, how to remove it? Can it cause inflammation? Absolutely. Glyphosate, actually, there was a lawsuit in California that was just where the manufacturer of glyphosate was sued, and I can't remember the quantity, but it was hundreds of millions of dollars. They were found liable for creating a man's lymphoma, so creating a man's cancer. In that regard, glyphosate can definitely create inflammation. How do you get rid of it? You buy organic, or you grow food in your backyard. You grow your own garden. A lot of people will say, well, that's not realistic. That's not realistic. Well, guess what? If you want to live and you want to be healthy, you need to make sure that you have an attitude where it can become realistic if that's what's necessary. Otherwise, you're going to have to cough up the money to buy organic. Now, some people will say, well, how do you trust organic? Good question. We do have laws. We do have governing laws in this country that restrict and regulate the ability for farmers to produce crops using pesticides and other chemical compounds. And so you have to have some level of trust. But if you've gone that route already and you've already gone organic and you find yourself still reacting because there's glyphosate contamination, I actually test people for glyphosate in that way to see if that's happening or if that's not happening. But if you find yourself not trusting those food sources, then yeah, you've got to basically provide for yourself, and that means farmers, co-ops, going and talking to the people who grow the food or growing the food yourself, becoming well versed in that arena. Fibromyalgia. Any opinion on what is good for fibromyalgia? Yeah, no grain, no pain. If you don't have a copy, go pick it up and follow it for 30 days. I would be surprised if you chime back in another episode and didn't find a dramatic improvement in your pain. Let's see here. All right. Looks like we got most of the questions. A lot of these are repeat, but it looks like we got a number, or the vast majority of them answered. So, again, if you know somebody who's struggling, who could benefit from this information, make sure you pass it on. Make sure you share it with them. Our goal here, don't forget it, we're trying to save 100 million people. There are 100 million chronically sick people who need our help, and we want to pay it forward. So you come here to learn. All I ask of you is that you pay this information forward and share it, because together we can help change and save the world. This is Dr. Osborne with the Pick Dr. Osborne Brain Show. We'll be back again for another special episode tomorrow night. So tune in tomorrow night, Tuesday. I've got a special guest. We're going to be talking about essential oils and hormones. So if you want to learn more about that, make sure you tune in and join me tomorrow night for a special episode at 6 p.m. Central Standard Time. Otherwise,